So hey everybody, I'm outdoors, so they're gonna hear the kids playing. So, okay. So I came to you guys in my last video about doing a or having done a transvaginal ultrasound, and I went through telling you guys I was gonna get it and asking if you guys got any. What did I ask you guys? I forgot. I can't remember. What did I ask you guys? Oh, I guess if you ever had it or whatever. What the procedure was like. Is it similar to pap smear? I initially had it set for a few weeks back, but had it rescheduled till today. So I had it today earlier. It's pretty much the same thing as a pap smear, although they're not using their finger. They're using, oh goodness, it's like nothing out here. Maybe something as long as this, but maybe about that thick. It's inserted. It's a condom on it with some really cold gel, and has a camera on it. So it's inserted and shows your ovaries, your uterus. My uterus is tilted towards my back, where a lot of women's their uterus are faced toward the belly button. But that's not an issue. According to the nurse, it's pretty much like having brown eyes instead of blue. So I noticed while she was doing it that there was a difference between my right and left ovary, and she told me that that was fluid. So while I'm waiting for the doctor to come in and tell me my results of the ultrasound, I'm reading things, trying to figure out things, and doctor comes in and tells me the results.
No, we're not yet. Go ahead. Oh, water.
You can have water.
Water?
Yeah, a little bit of water, and you can have juice a little bit later. Why? So, my results. They weren't awful, but I was expecting a little bit. Basically what I was expecting was, oh, okay, there was a little bit of fluid, but you know, other than that, everything is fine. I did find out that it is going to take me a while to conceive because I have cysts on both of my ovaries. I have quite a few of them. I also have a fibroid. The fibroid is really small, so he said that doesn't raise much concern for him, but the cysts do. So it was a little disheartening, even though he said that my results overall were reassuring that I would conceive, but the probability of it being really hard is high. So I'm glad that I got it done, because I really wanted to find out if there was something going on down there, because I was having pain, and the fact that I'm going to be 30 this year and I want to have children. So I wanted to know my status on that, and I got it. So my next step is more blood work, just to check my hormonal balance, make sure everything on that spectrum is okay. So I go back on the 18th for that. Next time I'll try to bring you guys and remember to record it while I'm there, so that I can show you what they use, because I can't really, it's hard for me to explain it, but it was, I mean, if you had a pap smear, it's pretty much the same thing. It's inserted and it is spun around. Don't feel it. It's just pressure, like with your finger. Just looking. So that's pretty much it in a nutshell. Say hey, Bink.
Hi. Who's this?
It's a video. You can go ahead and finish playing because we're gonna have to do some reading too.
Okay.
She's special. That's my Bink though. So, those are my results. I have to tell you, if you get an ultrasound, the gel that they use, I mean, it's cold. I mean, it is cold, but it's not freezing or anything. I mean, you know, it's cold. It doesn't, but it's so much that they put on there that when they finish, you know, when you clean up, when you finish, after, you know, after you have your pap smear or whatever, when you clean up, it is so much down there. But it is important to make sure your vagina world is working properly, especially if you're trying to conceive, or if you're have any kind of, excuse me, any kind of irregular discharge, something like that. You always want to make sure that area down there is on point. Laid. No. So those are my results. It's bothersome, but at least I know what I'm working with. You know what I mean? So that is it. I wanted to just upload that video and let you guys know, since I said I was going to do it. So there you go. Have a blessed one.